My talk today is called Young, Black and Stigmatised, How Haematologists Harm Patients with Sickle Cell Disease. And I'm talking about three main areas how we do harm to patients with sickle cell. Firstly, we admit them to hospital for long periods of time. Secondly, we give them too many opiates. And thirdly, we don't give them enough psychological support. This all comes on a background of institutional racism, socioeconomic deprivation, and a lack of research funding. It's very difficult to fully look into sickle cell disease because there's such a huge gap in research funding. For example, in the States there are 3 times as many patients with sickle cell disease as cystic fibrosis, yet per patient cystic fibrosis patients get 10 times the funding. So there are studies out there, but they tend to be quite small scale and they're often not randomised big control trials. So the most common misconception about patients with sickle cell disease is that they are drug addicts. So when you ask haematologists what percentage of patients do you think are drug addicts, a third of us think that over 10% of sickle cell patients are addicts. 5% of haematologists think over 90% of patients with sickle cell disease are drug addicts, which obviously has an influence on how we look after these patients. In fact, the way that sickle cell patients are presenting is probably more to do with pseudo-addiction than true addiction, but because they're young, because they're black, all these prejudices add up to people thinking that they're addicts. It's a very difficult question to know how best to address this. I think we need to start with a multidisciplinary approach that needs to begin in childhood. Patients with sickle cell disease need to have psychological support to help them manage their pain, to help them know that they're probably never going to be completely pain-free and there's going to be an element of chronic pain, but there are ways to manage it, for example, psychological techniques they can use or non-opiate based painkillers. My message to the haematology community is advocate for your sickle cell patients, fight for them, fight for research funding, try and perceive them as an individual who needs a multidisciplinary approach, don't just admit them and throw drugs at them.